So if you're a woman in South Sudan, you have a 1 in 7 chance of dying in childbirth in your lifetime.
We are looking into this research to actually assess the quality of care, because much as we have implemented standard-based management and recognition, it has not translated into the results that we have wanted. In that, as a country, our maternal mortality ratio has remained high. It may be a challenge to the government, because government has to have the adequate resources to be able to motivate these health workers.
L'indicateur d'impact que nous visons, c'est la réduction du taux de mortalité maternelle et néonatale. Et nous voulons, dans le cadre de ce projet, mettre en place les bonnes pratiques dans la prise en charge de ces 2 traceurs pour agir sur le décès des nouveau-nés et des mères. Et on souhaiterait que, aussi bien au sein des communautés qu'au sein du personnel de santé, ces bonnes pratiques soient bien comprises et que ces bonnes pratiques soient effectivement mises en œuvre dans les formations sanitaires et au sein des populations pour de meilleurs résultats.
The more important challenges, I think, are around the tensions between learning and reflecting and doing research and thinking on the one hand, and the incredible urgency to act. The health indicators are abysmal and the resources are very, very weak in both countries, especially in South Sudan.
We have the quality improvement teams thinking of the barriers to implementing quality services at district level and health facility level, and coming up with solutions.
The new interventions that we're using are very novel. They haven't been used before in the developing world, like bubble CPAP, and we're planning to put them out in places where they haven't been used before at the district level. And we're also planning to try to get a sense from all levels of healthcare, both from the patient's point of view, the family's point of view, as well as the healthcare provider's point of view. How easy is it to use these? What are the kind of barriers to using these? And people haven't looked at that in a systematic way in Africa before. So we're hoping to get some useful information that will let us know how practical this is on the long-term basis.
Il s'agit d'un projet de recherche sur la mise en œuvre du financement basé sur les résultats en santé de la mère et de l'enfant et de l'équité au Burkina Faso, avec pour objectif bien sûr d'améliorer la santé de la mère et de l'enfant à travers une meilleure connaissance des réformes sanitaires mises en œuvre dans ces 2 pays. Concrètement, il s'agira d'observer comment est implantée de 2 réformes majeures qui sont le financement basé sur les résultats et des interventions de protection sociale visant à prendre en compte des indigents, essentiellement les femmes et les enfants, afin qu'ils bénéficient d'une exemption de paiement pour accéder aux soins de santé.
On veut produire des connaissances sur l'intervention en question, c'est-à-dire le financement basé sur les résultats, et notamment en ce qui concerne les processus, les logiques d'acteurs, les adaptations des acteurs sur le terrain, etc., etc. Donc nous allons beaucoup plus travailler sur le processus que sur l'impact.
We hope that we'll be able to generate evidence to show that yes, indeed, these providers can be trained and can acquire the skill for the recognition and evidence-based treatment of perinatal depression, and also that we can indeed build a pool of trainers that will become available for the government to scale up and roll out this kind of intervention.
So we've taken 2 approaches, one modeled after the alert community system in Indonesia, and one called the prepared hospital. We put those together to form this systematic approach. And we have 4 research questions. What impact will this have on the context of the community? What impact will it have on access? Will it make a difference to that woman who's saying, should I go? How do I get there? And what do I get when I get there? Sustainability, how much does it cost? We'll have a cost-effective measurement here. And what does it take to keep it going? And finally, how effective is it? Does it really decrease maternal and newborn deaths.